Professor, would you like to, how would you get health to actually dictate terms to agriculture?
That's way above my pay grade.
Right.
I can't answer that. But I'm much more familiar with the agriculture side of this. And let me remind all of you that the cotton prices are extremely high right now. So if I'm a farmer and I can produce cotton, I'm probably going to do so instead of producing food. Don't blame me for doing that. I'm trying to feed my kids and make some money so I can buy whatever I want to buy. So the solution to the problem that David is raising, it seems to me, is unit cost reducing technologies for food production so that farmers can make more money producing food than producing biofuel and cotton. And that's in complete agreement with what David was saying. There's no disagreement here, but farmers are better economists than many economists, and they're going to do what they can make money from doing, given certain risk considerations.
Yeah, the problem is that perhaps health is not a very powerful actor. So I think our responsibility would be to try and make the case for investment for health in a much more powerful way. I mean, we have ways to demonstrate the development implication of certain investment. We need to perhaps describe better the health impact of agricultural policies, and I don't think we're doing that well enough. There are enormous driving forces. We've talked about mainly primary production, but of course we have to talk about the whole supply or the whole value chain. And the food systems are driven by enormous financial interests. I think we need to understand that and accept it, that's where the world is going. But at the same time, I think there are powerful governance tools that can be considered. And I was very pleased to hear a lot of discussion about trade considerations. Can actually trade considerations be addressed in these issues, and can dynamics of subsidies and taxation be taken into account to orient the direction in which agriculture is going? I think we have on our side at least a greater awareness and a greater commitment. It's true, where policymakers understand this. Perhaps we need to also address it at the global level. So can we have a new type of agreement that considers health as a main element in agriculture, as we did 20 years ago? Perhaps it's a time to do that type of discussion and to have that agreement again.
How do you link, you mentioned linking health outcomes to agriculture. How do you actually do that practically?
Well, firstly, I think that to the increasing recognition that health outcomes are influenced by government policy is extremely important. And so just 2 or 3 very quick examples. We have now got much greater work internationally on tobacco, thanks to the epidemiology of 40 years ago that showed the links between tobacco and cancer. And then the painstaking efforts by a combination of public health experts, activists, and key government officials to take that information into the public health community to lead to an international convention backed by law on tobacco control, which then gradually starts to feed back, and it's not quick enough, into those parts of the agriculture system that are concentrating primarily on tobacco production. In the long term, those of us who believe that there need to be some effort to link together the health consequences of tobacco and the production of tobacco would like to see the results of public health legislation leading to changes in growth patterns at the community level. It's underway. It takes time. As Francesco said, there are other interests to deal with. A similar example is the work on non-communicable diseases. Those of us who work in the public health field know that there is a huge personal illness and economic burden associated with diet and lack of activity and linked to various kinds of non-communicable disease. Now, the work then has to be done to encourage policymakers to understand that they can act to reduce the risk of non-communicable diseases. That then needs to feed through to the retailers, who themselves can act to reduce the extent to which they are marketing foods that might, in the long term, be influencing non-communicable disease, and that can then feed back to the production system to try to make sure that efforts are put into greater production of vegetables and lower production of stuff that is bad for people. The 5-a-day vegetable program, I believe, has probably had an influence on the market for vegetable produce, and that in turn is the kind of feedback loop that I think we're trying to influence.
Okay. Would you like
Can
to
I just
respond?
pick
Yeah,
up on what David was saying about tobacco, because I think this is a very interesting example. I mean, in public health, we do not have a lot of important treaties, and actually we have now the Framework Convention of Tobacco Control, which is a very successful treaty, and is binding governments to accept a series of measures that are driving the supply of tobacco products. So there's been a debate whether there should be a similar type of initiative also in the area of the food supply. I'm not sure what's going to happen. We look forward the summit on non-communicable diseases in September, organized by at a side to the General Assembly. So maybe that's a place where this type of discussion is going to take place. But probably we need, in addition to what we've said, also a major international commitment to make this happen.
Would you like to add anything? No. Okay, I'll just quickly sort of draw 2 points, I think, essentially made here, that we need to sort of have a more integrated fusion of sorts of all the 3 sectors, and then shaping agriculture, an agriculture growth policy, which will take into account concerns of climate change, smallholder farmers, women. Is there anything else that you would like to add? I'll just give you 2 minutes each to wrap up. Yeah.
Thank you for giving me the lead in to a commercial, but we actually didn't arrange that ahead of time.
Right.
I just had a book published.
Right.
That concludes.
Well, I was wondering what that was about.
That concludes that the solution to improving food security, nutrition, and health through the agricultural system is a holistic, multidisciplinary, multisectorial approach. This particular book deals with the African food system and human health and nutrition. And just so you don't think I'm a gold digger, whatever honorarium I get goes to Doctors Without Borders. So if you feel like buying the book, don't be bashful. But I think, on a more serious note, I think this is critically important. We need to break down these artificial barriers among the various sectors, among the various disciplines, and we need to do it fast. Now, how do we do this? We probably start in training, so that nobody leaves any university without having a full understanding of the importance of a holistic approach. And then we can move towards the referee journals and see if we can't get some credibility associated with publishing multidisciplinary papers. And I'm talking as a university professor, there are a number of things we can do, but certainly at the community level there is a need to work closer together, and let's have the ministries working together. Let's see if we can break down those artificial or not so artificial barriers. Let me make one other point, since I have a feeling you're not going to give me another chance. I'm very concerned, I want to come back to the food price volatility. I'm very concerned about that. We all really need to think in terms of risk management tools for poor people. They don't have the buffer right now. They don't have the risk management tools to deal with a doubling or a tripling of the rice price over a couple of months. The doubling of wheat prices every time there's a drought in Russia or there's a flood in Australia. These people suffer from these dramatic fluctuations. We've got to find a way, and I don't have time to list those risk management tools, but they are well known. Thank you.
Dr. Bracken?
Yeah, unfortunately, I've still not written the book, so maybe next conference. No, but I think it's a good opportunity. So I'll also make a commercial, because I would like to say that it's very important, David mentioned it in his intervention at the beginning, that we now have a governance system for food, and that's a Committee of Food Security which has been reformed, and this committee is actually now engaged in the development of a global multi-sectoral framework. I can't remember exactly the name, but that would be on food security and nutrition. So I think there's an enormous opportunity to actually discuss what could be the content of a global agreement on food security and nutrition. The question is, are we going to be able to incorporate health consideration in that? And I think we need to work hard on that. Together with FAO colleagues, we are thinking of working towards that and towards the reconvening in 2012 of an international conference of nutrition 20 years later. So that definitely from our side is the commitment to analyze what has happened, how food systems have evolved, what has been the role of different agriculture and health policies, has anybody been able to shape the agenda or not, and what could be the role of different stakeholders. And we're talking about the role of the public sector vis-a-vis the role of the private sector. Everybody can work together in a synergy. I think we need to analyze what has happened and then decide and provide some elements for the future.
Dr. Nabarro.
You look anxious.
Oh,
Is there a time problem? Time?
Fine. Okay.
Time stands still when you want it to.
We're fine.
A few words. Just very short. These are because they're important for me. People themselves don't live in compartments. Their lives are whole. It's only people like ourselves who operate in compartments because we work for different government departments, different organizations, or we have different professions. It's a golden moment now for working across professions and disciplines. Let us all become professional silo breakers and work to the interests of people who live whole lives and not fragmented lives. Number two, the future of all that we're doing, whether it's amongst ourselves or with wider communities, is through working in partnerships, networks, and movements. And it's something that many people in this room are really brilliant at doing, and we need to look at those parts of our way of behavior that are associated with building adherence to ideas and really development. Thirdly, don't forget about livestock. If you're thinking about human health, don't forget that there are major threats to human health associated with livestock. And this quite commonly is ignored in discussions about the future of agriculture. I'm quite associated with this because of my work on avian influenza in the last few years. But there are many other situations in which animals can contribute to risks to human health. And lastly, we've got lots of good stories to tell in this room. There are many good communicators here, but there ought to be more. And let's all learn from people like Howdy Buis, who was talking this morning about his work on biofortification, and the others who are so well able to tell good stories, because that's what's going to matter in the end. Thank you.
Thank you. You've been a great...